early on when it was really hard to get, right? Folks couldn't just buy N95s or surgical, and here you were showing me how to cut my t-shirt, and because you kind of really emphasized the science of masking early. So I want to ask you, because it's relevant again, you know, as some Bay Area officials are urging people strongly to mask, is it important now, looking at the numbers? I know you're a numbers guy. Is it important here in the Bay Area right now?
Yeah, so I looked into the numbers very closely. I actually led the world's largest and the world's first scientific evidence review for masks for COVID. It was published in the Proceedings of the National Academy of Science. Yeah, we found that masks are really pretty helpful to reduce transmission. And so, you know, that's obviously great both for health and the economy. Transmission has gone through the roof since we published that. And, you know, it seemed at the time like it was a pretty uncontroversial suggestion to, you know, put a bit of appropriate kind of something over your face to help you not get sick and help your community not get sick and also stay at work and keep the economy going. But it turned out to be very controversial, much to my surprise. It's at least as important now as it was back when we first suggested this idea in March of 2020.
Okay. You were kind of prescient there for sure. Right now, I want to take a look at the differences between the U.S. and Australia, where you now live, right? When the pandemic started, you were here in San Francisco. But let's compare, because there's a reason the New York Times article yesterday chose Australia as the country to compare the U.S. to, because we have some similarities, right? First of all, what are those similarities in terms of demographics?
Yeah, I mean, you know, we are very similar. You know, we're countries that to a large degree both, you know, came from English colonists, and, you know, we share a lot of the same kind of values and language and so forth. But I think underneath the surface, there are some pretty stark differences, and it's those stark differences that's led to, you know, in the end, a 10 times lower death rate from COVID in Australia, and also, frankly, a much, on the whole, higher level of freedom here. So here, you know, when we arrived about a year ago, there were no restrictions of any kind. And so we, you know, went to restaurants and we went to sports events and we did it totally safely because there was literally zero COVID in our state.
How did they manage that? You know, I know you said at the time when you arrived, there weren't mandates in place because they weren't warranted. Right now, I believe you're seeing cases, you know, increasing. Are mandates necessary, and are people fighting it, saying that it's infringing on their freedom?
Yeah, so what happened in Australia at the very start of the pandemic was that there was a bipartisan decision to focus on the science. And so that was a really fantastic step back in March of 2020. And this, you know, the scientists were saying this could be a global pandemic. It could be pretty bad. It could hit economies hard. It could really hurt this country. So they said, okay, well, let's stop it coming in. And so they closed the borders. Now, obviously, this had a significant effect on things like tourism, but it meant the country could continue to function and that Australians could continue to live normal lives. So that was the key thing that happened, was this very big call that happened very early on. And, you know, we know with this pandemic, it's all about speed. So this was done very, very fast. And what happened then was that gave us time to get vaccinated. Now, you know, bit of a by the way topic, you know, the government here kind of botched the actual vaccine deployment, but eventually they got it out to people. And I will say over here, there's a, you know, I definitely noticed there's a lot more trust of science and medicine. And by far on the whole, people, when the vaccine came along, went, oh, that's great. You know, we like vaccines and we use them for our kids and we use them for ourselves.
What's the vaccine uptake there versus here?
Yeah, it's about 95% over here, over 95%. And so it's basically everybody. I mean, look, in any country, there's going to be a few extremists and conspiracy theorists and whatever, but
yeah.
I really never come across them in day-to-day life. I mean, that's much higher than our,
you know, we're like at 70%-ish, you know, so that's a big difference. But one thing I thought was interesting, Jeremy, is there's a poll that showed the percentage of people who say they trust the healthcare system. In the U.S., it's 34%. In Australia, where you are, it's 76%. So that trust in the institution and the science, how important of a factor do you think that is?
I think it is important, and particularly because in the US there are communities with particularly low vaccination rates, and to a large degree, that's often based on an entirely understandable and reasonable distrust of a medical system that has failed groups of people. So in America, Black Americans in particular have had many kind of terrible things in their history of handling from the US healthcare system. And so there's a very natural kind of skepticism and caution. But unfortunately, that's led to high death rates in these communities where there are lower vaccination rates. So, yeah, I definitely notice here that one of the things that I thought was really interesting when we arrived in Australia, things were just taken very seriously, not in a kind of antagonistic or authoritarian way, but in a respectful and friendly and helpful way. So when we arrived, there were people who, immediately kind of did our health tests and made sure we got on the right bus and, for our quarantine. And then from time to time, here in Queensland, where I live, there would be like one case. And it'd be like, oh no, there's one case. And so we'd go into like a 2-day lockdown and would have 2 days of like mask mandates just to make sure that that person didn't infect others. And everybody went along with it. When I went around in my community, there was a very high level of compliance with these brief mandates because we knew that once it was done, we could get back to our life, a couple of days later. And that worked really well.
Are you saying that people trust each other there more from what you've seen, having lived here and now there?
I've certainly noticed a much lower level of kind of antagonistic aggression, but like in the media, you don't see kind of people yelling at each other so much. There's definitely, yeah, I feel like there's this very strong cultural value here of mateship and giving everybody a fair go. Which I like. And one of the things that's resulted in is that there's a very strong social safety net here. So you don't kind of have the same levels of like desperation that can actually lead to significant societal problems. Yeah, so I think it's part of the culture here, and it's kind of part of how we're set up, and it's something I really like about being back here, actually.
Well, Jeremy, given that it's very hard to change culture, what could we do? What advice would you give us moving forward here in the Bay Area as we maneuver more surges to come?
Well, the Bay Area is closer, I think, to Australia than any other part of America I've been to. And you can see that in the COVID outcomes. I mean, the Bay Area has done such an exceptional job by the standards of large cities in America. There's a much higher level of kind of understanding of and trust in science. But one thing we've seen in really every Western jurisdiction is us Westerners tend to respond much more to mandates than to recommendations. We are more individualistic perhaps than some other areas. And so we've seen in the data that it's not until you actually put in place a mask mandate that either in Australia or the US that people tend to stick to it. Now, one of the big problems is not just that the mask mandates have almost entirely gone away in both countries, and they're now, as a result, seeing surges in mask use, but also there's very, very little messaging, let alone mandates around using effective masks. And these newer variants are so transmissible. I would never go out in public without an N95 now because that's the minimum that you need to have some level of safety, in my opinion.
And look, it's not just the quality of the mask, it's the fit, something you've always emphasized, even when you launched Mask for All. Thank you so much, Jeremy Howard. Really great talking
Thanks,
with
Kristen.
you. I know you're an ocean away, but we hope to have you back on again soon. Take care.
I'd love to. It's a pleasure.
Take care. All right, we'll be right back, and we'll talk with San Francisco Mayor London Breed, so don't go away. All right, everybody, we'll be right back. The Bay Area was the poster child for doing exceptionally well during the first 2 years of the pandemic, but right now our region has some of the highest COVID rates in the state. San Francisco's 7-day test positivity average is up to 9.9%, and the case rate is about 40 out of 100,000. But experts believe that's a gross undercount due to optional testing these days. Joining us now to talk about this and other big issues facing the city is San Francisco Mayor London Breed. Mayor, thanks for your time.
Hello, thank you.
All right, well, it's great to see you. Right now, though, health officers are strongly urging people to mask up indoors. If the numbers don't head downward soon, could you see a scenario in which the city would have a mask mandate again?
Well, not at this time, Kristen, because the fact is, we're at 9 people in our hospitals right now. We are in our ICU in particular, and we continue to see, even though the numbers are going up, we're not seeing the hospitalization rates go up. We're not seeing the death rate go up. So the biggest thing that we want to do is prevent the loss of life. And I think we're doing a really good job at that. So as long as we're in a good place, we'll continue to push for vaccinations. We'll continue to try and help educate people in everything we can and encourage masking. But at this time, it doesn't look like we're going back to any requirements.
Okay, and we're at a place now where people are kind of assessing their risk in each individual situation. Are there situations now where you are personally going back to masking when it's a public indoor space?
I think it definitely depends. So for example, if I go into maybe a hospital location where we might have vulnerable patients, a closed area, a place where there isn't a lot of ventilation or circulation. So it definitely depends. But what I've noticed is there are a lot of people who are doing a lot more outdoors. So there are a lot of great outdoor events. People are really excited. I definitely have pulled back on shaking hands and a couple of other things. And I do think that, as I said, we're doing a lot better, but we want people to be cautious, especially those with underlying health conditions. And we want to continue to encourage people to get a vaccine.
Yeah. And speaking of events, I know back in March, the city held some big events to welcome office workers back downtown. Now we're seeing several large tech companies delay bringing people back in person, and PayPal is closing its San Francisco offices altogether. What can you do to bring the economy back and quickly?
Well, one of the things that I am doing, of course, is reaching out to CEOs of these companies. I've in fact visited a number of these places that are coming back. And in fact, some of these places are deciding to make San Francisco their headquarters, even though they have somewhat of a work from home plan. I'm going to continue to push and encourage people to come back to work, because as much as I know that people are concerned, we have this knowledge that we didn't have before when this pandemic first hit. We know that masking is very helpful. We know that washing your hands and keeping some level of distance could be very helpful, but ultimately COVID is still here. It changes its variants. It's just not as problematic because of the vaccine. So I would, of course, continue to push and encourage companies to bring their workers back to work. Many of them have done so, including many of our financial institutions, which have required that people return to work 5 days a week. I'm at the office every single day. I'm around the city every single day. So my hope is that the excitement of all the great things that are happening in the city, including the Warriors in the playoffs, the Giants are playing at Oracle Park, these great parks and open spaces are open. So many wonderful things are happening here. So I'm going to continue to push and encourage people to come back.
Yeah, you and me both working the office. We're doing our part, right? Got lunch at the Ferry Building and sat outside. It was really nice. I want to shift gears a little bit here. I know this is big for you as well. Patients at Laguna Honda Hospital got eviction notices yesterday as the city fights to keep federal funds and keep operations going after those 2 non-fatal patient overdoses last year. Where would they go if evicted, Mayor? And you must be worried that this could worsen homelessness.
Well, I got to tell you, this has really been a very difficult time for us, especially the patients at Laguna Honda. We are working with CMS, which is our federal partners, to try and deal with some of the violations that occurred at Laguna Honda. And let's just take it back a little bit, because we're talking about one of our largest assisted living facilities in the country. And when COVID first hit, you saw a number of elderly patients who died in many institutions like this all over the country. And in fact, in Laguna Honda, throughout the entire time of this pandemic, only 6 patients died from COVID. So we are a great facility. It's a safe facility. It's not without its challenges because there are a lot of patients. We are hopeful that the CMS will work with us on the recertification process, which we expect to take 4 months. We were required under the law, as we do this recertification, in order to continue to get funding for Medi-Cal and Medicaid, to do these letters to the patients to make them aware of some of the transitions that we have to do. We're going to, of course, fight like heck to keep this facility open and work with our federal partners to do so. It has been a really challenging and somewhat frustrating process. And my hope, with all of the improvements injected under the guidelines that we require to do so, that they would be open to making sure that once we recertify, we're able to maintain operation at Laguna Honda Hospital. It's been frustrating. It's been complicated. We have been working with patients directly. And right now they know that we're still running, we're still receiving funding. We are going through this process. We expect to receive funding for the next 4 months as we go through the recertification process. And so my hope is that that is going to give us the time we need in order to get through this process, address all the issues and concerns, and keep Laguna Honda open for the people that need it the most.
All right, Mayor, we only have about 30 seconds, but I've got to point out that yesterday the city released the preliminary results of the first homeless count since 2019, and I know you're pleased about it. What did it show, and how can we keep trending in that direction?
Well, it showed that unsheltered homelessness declined by about 15%, and overall homelessness declined by about 3.5% when other counties saw increases. And I think this has a lot to do with our investments, our resources that we are using to provide services in addition to housing, to make sure that people don't end up back in the streets. Because one of the problems that we've had in the past, people feel as though homeless people were pushed from one neighborhood to the next neighborhood. Our goal is to get people housed and to keep them housed. And so a lot of the work we've been investing in has a lot to do with that. I'm really hopeful about the future in light of the numbers that we see, but we also know that this is far from being over, and we got a lot more work to be done, and building more housing, purchasing more buildings, and some of the great work we've been doing to shelter people has been tremendous. And I just was the day before yesterday at a location where we opened up 160 units for people who are formerly homeless on the streets, where they're getting wraparound services and they have their own affordable, safe place to call home. So that's what it's about, and we're going to keep working hard to keep those numbers down.
All right, Mayor Breed, thank you so much. Nice to see you.
Thank you, Kristen.
And we'll be right back with the San Francisco Standard. All right, be right back, folks. All right. We reported last week that the San Francisco Police Commission is discussing banning police officers from making traffic stops for minor offenses, often with the goal of investigating the occupants for something else. Now comes word the city is preparing to pay a $375,000 settlement in connection to one such stop. Joining us to discuss this is a reporter with our media partner, the San Francisco Standard, Michael Barba. Michael, nice to have you on. Quickly explain what a pretext stop is and why critics want it to end.
Thanks for having me. A pretextual stop is a police practice where officers pull over someone, often for a minor traffic offense, and they end up, they do that because they really want to investigate them for another unrelated crime. The reason why advocates want that practice to end is because they say that these traffic stops too often impact people of color and Black people in particular, and can needlessly lead to situations where officers use force.
And they say a prime example of that is this case that we're talking about, a lawsuit brought forth by a man named Arthur Higgins, and a $375,000 settlement. Tell us what happened to Higgins.
So Higgins was sitting in the backseat of a car when the vehicle was pulled over for sitting in a bus zone in North Beach. And an officer grabbed Higgins by the wrist without warning. And the incident basically spiraled out of control from there. He was struck with a baton. He was pepper sprayed, and he ended up on the sidewalk being punched and kneed by several officers.
All right, you interviewed him, right? Did he tell you the impact of that stop on him even now?
Yeah, I think he feels fortunate to be alive. I think he realized in that moment how quickly a situation can escalate, even when he felt like he wasn't doing anything. When the incident happened, he was smoking a cigarette in the backseat of a car with his friends.
All right, I want to show folks some numbers that you have in your story because it shows the racial disparities. They're eye-opening. Clearly, you can see for Blacks, the stops per 10,000 residents is much higher. So talk about this new proposal to change these kind of figures. What does the new proposal entail? Would it ban minor traffic stops altogether, or does it spell out just limited circumstances that would allow them? Tell us about that.
The proposal's goal is to ban pretextual stops, but because pretextual stops themselves are a bit of a gray area in determining which incident is a pretextual stop, what it would do is basically ban minor traffic stops altogether, and it picks a subset of minor traffic stops and lists them out, and those would just be off limits for police officers to pull someone over for. An officer would still be able to enforce a traffic violation by sending a ticket later, but would not be able to pull someone over for those certain violations. The second part of the policy is there would be limitations on questioning. So the officers would not be able to ask people questions afterwards once they pulled someone over in the first place, unless they had a significant reason to.
All right, we have about 20 seconds, but I want to ask you if there's been pushback from police officials who might argue that banning pretextual stops would interfere with their investigations.
Yeah, I mean, the police union says that this is a useful tool. They haven't taken a formal position on the policy, but they believe that pretextual stops and traffic stops help remove guns and drugs from the street. I think the police chief is supportive of the idea of banning pretextual stops. He says nothing is off the table, but I think the devil's in the details in terms of how this will all shake out.
All right, Michael, thank you for keeping us posted as this debate continues. We do have links to the Standard's other original reporting on ABC7news.com. We'll be right back. All right, Michael, if you're still with us, we have a couple minutes here to finish on Facebook Live. So when do we expect the Police Commission to make this final decision?
It's not going to be something that happens anytime soon.
Okay.
Basically, within the last week or the last couple weeks, the Police Commission decided that, just introduced the proposal. So it showed the public what the policy might look like. And now for the next couple months, there's going to be public hearings and other events where the public can engage with the Police Commission on this policy and really have a say in how it ends up getting crafted. So it's not going to be until about next fall, probably at the earliest, that this policy might get approved.
All right. San Francisco Police Union's acting president, Tracy McCrae, says that officers are trained to stop people based on behavior rather than the color of their skin. What specific policies or training within the police department are in place that support that statement?
You know, that's a good question. I think what she was saying, though, is that, you know, yes, it happens to be the case that a lot of folks who get pulled over are Black, but the point she was making was that that's not because officers are racist or because of any sort of bias. I think she's just saying that they pulled them over because they have other reasons to.
I see. Other than for the color of their skin, right? Is her
That's
intention?
correct.
Okay. Was there any past history with the officers that beat Higgins, you know, that would suggest that this could be racially motivated?
Not that I'm aware of, no. What I can tell you, though, is that the police department's watchdog agency, the Department of Police Accountability, reviewed this case, and they sustained allegations of excessive force against all 4 officers who were involved in this incident.
I see. Okay, Michael Barba, thank you so much for your reporting and for talking with us today.
Thank you.
You can read his whole story on our website, which links to the San Francisco Standard.
4, 3, 2, 1.
Thank you so much for joining us today on this interactive show, Getting Answers. We'll be here every weekday at 3. World News Tonight with David Muir is coming up next, and I'll see you back here at 4.